Is haloperidol safe for elderly patients? Have you ever wondered about the safety of haloperidol, especially for elderly patients? This first-generation antipsychotic is often used to treat schizophrenia and other psychotic disorders. However, when it comes to older adults, particularly those with dementia-related psychosis, there are several important factors to consider. Haloperidol has a well-known safety profile, but it carries significant risks for elderly patients. Studies show that older adults treated with haloperidol have a higher risk of mortality. Specifically, this risk is about 1.6 to 1.7 times greater compared to younger patients. This is a serious concern when doctors consider prescribing haloperidol to elderly individuals. Additionally, elderly patients are more likely to experience adverse effects from haloperidol. One major issue is the development of extrapyramidal symptoms, which are movement disorders caused by the medication. These symptoms can include tremors, rigidity, and a feeling of restlessness known as akathisia. Another concern is orthostatic hypotension, which is a sudden drop in blood pressure when standing. This condition can lead to falls, which are particularly dangerous for older adults. Cardiac risks are also a factor with haloperidol. Some patients may experience arrhythmias, which are irregular heartbeats. Because of this, doctors often recommend careful cardiac monitoring. This includes performing baseline and follow-up electrocardiograms to ensure the heart is functioning properly. In general, the use of haloperidol in elderly patients is advised only for short-term treatment. For example, it may be used to manage acute delirium when non-drug methods have not been effective. When prescribed, the lowest effective dose should be used for the shortest time possible. This approach helps to minimize the risks associated with the medication. For elderly patients with schizophrenia, haloperidol can be effective, but the side effects are a significant concern. Research comparing intramuscular haloperidol with other antipsychotics, such as olanzapine, shows that while haloperidol works well, its side effect profile requires careful management. In summary, haloperidol can be used in elderly patients with schizophrenia, but it must be prescribed with caution. The increased risks of mortality, neurological side effects, and cardiac complications mean that doctors must weigh the benefits against these risks. Close monitoring and using the lowest possible dose for the shortest duration are essential to ensure safety in this vulnerable population.